I'm Steve, here as always with Dr. Nario for our weekly interview. You guys know where Dr. Nario is. He's in Reno, Nevada, his clinic there, and you can check them out online. Biointegrative Health Center is the name of it. And we're going to talk about chelation, which is a fascinating topic and a phenomenal treatment. So thanks for being with us,
Hi,
doctor.
Steve. Thank you for having me again. Always a pleasure.
Okay, so what is chelation? I mean, there's lots of ways. I mean, there's different things you can take. I mean, there's seaweed and all kinds of stuff, but just give us a kind of a description or just tell us what is
Well,
chelation.
Steve, chelation therapy is a medical procedure that involves the administration of chelating agents to remove heavy metals from the body. And as you said, different methods, may it be oral, may it be IV. But the concept here is think of a magnet binding metal in your system. And then, of course, as you excrete them out, you push the flush button, and then it goes down the drain, it goes out of your body. Not that easy in reality, though. Metals like they're like scum dirt or barnacles that sticks in our vital organs. Very hard to reach. The longer it sticks, the more damage it can produce. It likes to stay in the brain, the heart, the liver, and more of the vital organs. And we need a special antidote to remove it. There are three commonly used in our practice, and as you said, there are some that you can do at home, but as we use it here in a medical clinic, EDTA, that's one of our more famous ones, and that chelates the most metals, including calcium, iron, and lead. One also is a new one. It's not a new one that, but we introduced it into practice. DMPS, mercury, and is something that it is highly attracted to, and also DMSA, which is something that you use orally, and now this chelates lead and mercury a lot. It can still attract the other ones, but this is the more common ones that it does. And an add-on that we like to do along with these would be glutathione, a natural detoxifier that stimulates the liver to help flush all of these metals out. And you will hear chelation or EDTA word used in the laboratory, uses it as an anticoagulant, and still used today in those purple top tubes when you go to LabCorp or Quest. But also, not only is it known for heavy metal chelation or removal, but also for the cardiovascular benefits later on that we will discuss, especially in the IV form.
Hmm. Okay, so how does it work? I mean, I've done it. I've done the IV. Um, but how does it actually work?
Well, Steve, the word itself, chelation, is the Greek word where it came from. Is chele means claw, and organic molecule binds to a positive charged molecule. So from the claw, the metals are actually going to bind together in a pincer-like fashion. So the most common chelator, again, as I mentioned to you, is EDTA or ethylene diamine tetraacetic acid. Let's just call it EDTA for everyone there. And tight bonds with variations of toxic heavy metals are made, like mercury and lead, and gets removed also from the system. Even calcium, it also attaches to excess calcium. It is excreted
Hmm.
via the kidneys. Why minimum workup is a metabolic panel, as we call it, where we will see the creatinine or the GFR to assess kidney functions, to calculate even the dosing of these medicines. Metals, you have to remember, are environmentally toxic, associated always with cardiovascular disease such as lead, arsenic, mercury, cadmium. The mechanisms and how they do that is they increase free radicals in the system, promote inflammation, affect the functioning of blood vessel lining, blood pressure levels also increase, and induces organ dysfunction.
So it sounds like there's a lot going on there, but can you tell me a little bit about the benefit of chelating? So what benefits are going to come with getting some of these metals out of your body? So you kind of told us about how it works, but what are some of the benefits that people can expect when they start to get these metals out of their
Well,
body?
see, maybe a good explanation of this is let me explain how metals do damage. So, of all the metals, let's make lead an example because it's so prominent out there. We're just not aware of it. Like soil, there's fertilizers that we use on it that gets transferred to food. Bullets for the hunters, gun aficionados, the lead that emits smoke. even cigarette smokers, paints that are in old houses until 1978, lead gas in cars, and even lead pipes in water. We shower, we drink, and we gargle this. Cardiovascular disease is actually related to such metals, which also leads to high cholesterol and hypertension. As we all have to remember, number one killer in the world right now is cardiovascular disease. And lead exposure has been proven to increase the formation of plaques in the arteries. And also, by reducing lead, it also reduces cardiovascular problems, including diabetes. Extensive evidence that metal pollutants are associated with such conditions. And other metals that are around that we are still maybe not aware of: mercury, that we see in fish, iron in our water, and iron skillets. And as you can see, metals are not good. So I just enumerated all the bad things that metal does, and a majority of metals does the same bad effects. May it be arsenic, cadmium, and even mercury. When you remove this with chelation, and a lot of them use a lot of EDTA, you lower down the risks of all of these bad effects of these metals. So those are the good benefits that it brings.
That makes sense. So that kind of tells me well, my next question was who's a candidate for this type of treatment? It would be people who are having those symptoms, or can you elaborate on that? Who you do chelation
Well,
with?
Steve, we classify three categories for these patients. One, as I mentioned to you, the cardiovascular patients: diabetes, hypertension, high lipids, post heart attacks, strokes. Majority of these patients has high heavy metals, most of them that holds on to the plaque and creates inflammation in the blood vessels. That's number one. Number two category is the chronically exposed. These are the people who are occupationally exposed to these hazards through their jobs. For example, mechanics, miners, construction workers. Treatment that they will get will be preventative in the sense that we should lower the body levels as much as possible, even when ongoing exposure is happening, because these people cannot stop their jobs. They need to work, and this prevents the body from creating disease, and it cannot contain overload status, thus leading to tragic events. And the third classification would be the normal people. We are exposed to metals every day in our lives: the water we drink, the air we breathe, and the food we eat. Same for the occupationally exposed. They need to go through maintenance. So that's why I guess the answer is everyone.
Yeah, good point. It's a treatment I do. I do it every quarter at least. So that's definitely a treatment that I do. Now, is there any time or certain people that should maybe avoid getting this treatment because of other reasons? Can you tell us about
Right.
that?
Well, Steve, yes, there are contraindications to this. That's why, as I mentioned to you at the beginning, that we want to get a basic blood test, and we want to see the renal function of our patients. Renal failure, moderate to severe problems with the kidneys, they can be relative contraindications, but really, you need to find the function of the kidneys in order for you to actually get the right dose for them. If you overdose, you are going to give that kidney more of a load, and it's going to have a harder time removing all of these metals. Also, pregnancy. You cannot give this to pregnant women. And then again, there's some exception. There are studies that unless the patient is toxic with the lead levels, toxic lead levels, you can, but we don't do that here. And then total hepatic failure, meaning the liver is just busted up. And now you're not creating all the clotting factors, the proteins that the liver needs to make. And also, and as we spoke about, people who actually has amalgams in their mouth, because you are going to be leaching these amalgam fillings, and you're actually going to make these people worse. So as we suggest all the time, most of the time, that we want these amalgams removed.
Hmm, fascinating. Okay, everyone, at Dr. Nario at Biointegrative Health Center in Reno, Nevada. You can check out that treatment there or any other of the treatments that they do. It's all on the website. So thanks for being with us, Dr.
Well,
Nario.
Steve, thank you again. So here's a special note for everyone. I just kind of remember this, that EDTA actually has some studies in dissolving calcium oxalate crystals, or the ones who have stones, always seen on urinalysis. It's a big problem out there. and wherein the body could actually dispose more of these metals through the urine or sweating when you use these chelating agents. So again, thank you. As we all know, knowledge is power, and thank you for letting me provide you with edge and longevity and health maintenance, which I call the biological edge or the bio edge.